Well, know your status. That is what health officials are asking everyone in Knox County to keep track of. Tomorrow is National HIV Testing Day, and the Knox County Health Department is making a big push for people to get tested. Of all those infected with HIV in the United States, 20% have no idea that they're living with the virus. And joining us now to talk more about this is Dr. Martha Buchanan, the director of the Knox County Health Department. Thank you so much for joining us.
Thank you for having me.
Let's go ahead and just start off with right now. Tell us exactly what you guys are doing as part of National HIV Day.
Well, we're increasing opportunities for people to get tested for free. So we'll have testing at all of our locations and at some area pharmacies, as well as our staff will be out in the neighborhood, out at local bars and other places where people frequent and can get tested. With the new oral testing, they can get tested and know their results in 20 minutes, which is really cool.
Is that new oral test the same thing as the rapid test that we're hearing about, the one that people can actually go to a pharmacy and get and take the test?
It's very similar, and it's easy to use. It just has to be administered by someone who's been trained to do it. And so those pharmacy tests are pretty reliable. You know, if we all remember when pregnancy tests came out and they were over the counter, everybody was kind of leery of those, but they really have proven to be useful. And it's better than not knowing it all. So if somebody will go and take that test and then follow up with a healthcare provider to get more information, we really encourage that.
How long have those rapid tests been out?
They've been out for a couple of years now. They just really haven't taken off. And as technology's gotten better, they've gotten easier to use.
Well, that's good news. You know, as we mentioned, tens of thousands of people right now do you have no idea that they're even infected. So if people are sitting at home watching, who should go get tested? Should everyone go get tested? Should it be a blanket, everyone go out and get tested?
Everybody should get tested. Everybody should know their HIV status. Anybody who's ever had sex, period, needs to know their HIV status. So it's that simple. Everybody should know their status. And if you're having more than one partner, or if you have a new partner, everybody needs to know their status, regardless of your age.
You know, last week, I believe it was, we did a report where they were calling the Southeast, not necessarily Knoxville, but the Southeast kind of ground zero for the HIV spread of this virus right now. Why is that? Why is the Southeast being targeted?
Well, it's not really new for the Southeast to kind of be the area where we have a lot of HIV disease. Part of it's population density. A lot of people live in a small space in the Southeast, so we have a lot of people living in the Southeast, so we see higher numbers. So it's nothing new to us. We've watched that happen. We don't have a great explanation for it. It's really nothing to do with lifestyle. It's just, it's been that way for quite some time.
But we should stress, because some people will be at home, they'll hear this and they'll say, oh, Knoxville's the ground zero. These numbers aren't necessarily reflective here in Knoxville, correct?
They're not. And as a matter of fact, if you look at the state of Tennessee, Knoxville numbers have stayed pretty steady, gone up just a tiny bit. But if you look at Memphis and Nashville, the numbers have really gone up. And it's just like that everywhere else. The larger metropolitan areas have more HIV than the rural areas do.
One last question here. If someone cannot get tested tomorrow on National HIV Day, where should they go after that, and how much should they expect to spend on the test?
Well, at the health department, you can get tested 5 days a week, every week of the year, except when we're closed, for free. You can get tested at your doctor's office. Doctor's offices can do that as well. And, you know, I encourage physicians to be asking their patients if they know their status.
All right, Dr. Buchanan, valuable information. Thank you so very much.
Thank you.